If you are a patient that is planning to have an implant in the aesthetic zone, in the front area, you need to hear this. If you are a dentist that is planning to place or restore implants in the aesthetic zone, you need to hear this. My advice is try to stay until the end of the video. You will get valuable information prior to implant placement that will help you make informed decisions wisely and communicate with your doctor to achieve ideal aesthetic clinical outcomes. Implant provisional restorations are key to achieve optimal aesthetics. These are the 3 reasons why we need implant provisional restorations. To achieve an ideal aesthetic emergence profile, to achieve proper matching with the contralateral side, that is an even and symmetrical aesthetic clinical outcome, to favor proper papilla development, and to level the gingival and mucosal margins of the implant side and the contralateral side. Implant provisional restorations is a critical step to achieve optimal aesthetics and ideal pink aesthetic scores, which will determine the final aesthetic outcome and will make our patients much happier. If you skip the implant provisional restorative phase, especially in the aesthetic zone, there is a good chance your patients will complain and you will never get an ideal and symmetrical aesthetic outcome. The areas that will benefit the most from an implant provisional restoration are those in the aesthetic zone, in the anterior, maxilla and mandible, especially for single units. It is highly unlikely that you will achieve a good aesthetic outcome, optimal outcome, if you skip the implant provisional restorative phase. This is an example of a suboptimal clinical outcome of a front anterior implant that was placed and did not receive the proper provisional phase. The restorative dentist skipped the provisional phase, and as a result, the clinical outcome was not aesthetic because of lack of symmetry and a mismatch in the soft tissue margin between the implant and the adjacent tooth. My intention with this video is to bring awareness of the steps that need to be taken to achieve an ideal aesthetic clinical outcome in implant dentistry, especially when we place implants in the front, in the anterior area. This will help both patients and dentists understand what we can do to achieve ideal aesthetics and good long-term clinical outcomes. Implant provisionals must be delivered to guide the soft tissues heal properly and aesthetically around that implant restoration. Implant provisional restorations help sculpt the tissue until we can achieve an optimal symmetrical aesthetic outcome. If you skip the implant provisional restorative phase, there's a good chance your patients will not be happy with the end result because you will leave things to chance. And one of the key parameters of aesthetics, especially for imagine a central incisor, is the symmetry. Imagine you have an implant and a tooth, an implant and an adjacent central incisor, 2 central incisors adjacent to each other. You want to make sure the gingival margin of the tooth is symmetrical at the same level as the mucosal margin of that implant. That is key for optimal aesthetics, and the patients will be grateful for it. Imagine the 2 maxillary central incisors, one being an implant and the other one being the tooth. The provisional will allow you to match the level, the mucosal and gingival level of the adjacent and the implant side, so that the scallop of both the implant and the tooth are symmetrical. When we achieve symmetry, our patients will be happy. Not only about the level, the symmetry of the gingival and mucosal margin, it's also about papilla formation and the scallop that we provide with that provisional restoration. That is key for proper aesthetics, and the provisional restoration will allow us to play with the contour of the soft tissue, allowing us to achieve an optimal and aesthetic clinical outcome. After implant provisional delivery, we should spend a good 2 to 3 months, if not more, sometimes 4 or even 5 months, waiting for the soft tissue, for the peri-implant soft tissues to mature and arrive to the ideal emergence profile and aesthetic outcome, so that the matching with the contralateral tooth is as symmetrical as possible. Not only the level of the mucosal margin, but also the papillas. We want to match as close as possible the papilla height of the peri-implant tissues versus the contralateral teeth. When we achieve that symmetry, aesthetics will be there and our patients will be happy. Implant provisional restorations must be highly polished, high quality, as close as possible in symmetry to the contralateral tooth. We need to consider that sometimes we need to wait for the soft tissues to mature, and we are going to be able to guide them with our provisional restorations during those 3 to 4 months of healing time. So our restorative dentists should bring the patient in for checkups every 2 to 3 weeks to remove or add more resin to the provisional restoration to achieve the ideal aesthetic outcome.